So, in this video, I'm going to talk about general pharmacology. Okay. So, in general pharmacology, we're going to talk about two things: pharmacokinetics and pharmacodynamics. Okay. So, in this video, I'm going to talk about pharmacokinetics. What is pharmacokinetics? Pharmacokinetics simply means what body does to the drug. So pharmacokinetics means what body does to the drug. So what can body do to the drug? So let's assume you have taken a drug orally. Drugs can be taken orally, it can be taken intravenously, it can be taken intramuscularly, it can be taken topically. For now, let's assume you have taken a drug orally, okay? And this is your gastrointestinal tract. You have your stomach here and intestine, okay? And you have your body tissues here. You have your body tissues here, okay? Now, when you have taken the drug, okay, and drug enters into your alimentary tract, it gets absorbed. Okay, it gets absorbed into where? Into the blood vessels, and it remains in the plasma, or it enters into the plasma. Okay, then from the plasma, it can be distributed to the body tissues. So what have we found that body can absorb drug, it can distribute drug, okay, then the body can deliver it to the organs like liver and kidney, okay, where the drugs can be metabolized. And then after metabolization, it can be excreted. So in pharmacokinetics, we are going to know about absorption, distribution, metabolism, and excretion. Okay. The primary organ for excretion is kidney, but it is not a solely organ that excrete the drug. There is also liver that excrete the drug through biliary excretion. So there is biliary excretion of the drug. There is biliary excretion of the drug, and the drug is passed through the stool. Okay. In this video, I'm going to focus on the topic called permeation. So what does permeation means? So permeation means free movement of the drug, or movement of the drug, you can say movement of the drug throughout the body. Okay. So free movement of the drug throughout the body. In the permeation, first of all, the topic I want to discuss is solubility. So the drugs are mainly lipid solubles, and they can be water soluble also. But most of the drugs are made as lipid-soluble drugs so that they can easily pass through the biological membranes. We have biological membranes in our bodies, like in the gastrointestinal tract, we have the biological membrane. In the blood-brain barrier, we have the biological membrane. In the cell membrane also, and in the renal filtration membrane. In this size, we have biological membranes, and if the drug has to work on the body, it has to cross the biological membrane and gets absorbed. And in the renal system, when the drugs is into the renal tubules, okay, so let's assume that the drugs is in the renal tubule. If the drug is more water soluble, it will pass through the urine. But if it is more lipid soluble, it can cross these biological membranes and enter into the blood vessels. Okay, so the drugs are made mainly as lipid soluble drugs. So why the lipid soluble drugs can easily cross the blood-brain barrier? So we have lipid bilayers in the biological membranes. Okay, so these are the hydrophilic ends, and these are the hydrophobic ends. Okay, so lipid soluble drugs can easily cross this lipid bilayer. Okay, they can easily squeeze through this layer and cross the biological membrane, but water soluble drugs can't cross this biological membrane easily. If the water soluble drugs are very small in molecular size, okay, then it can cross this biological membrane. Okay, so we have to give the water soluble drugs intravenously into the plasma directly. We can't give them orally. Okay, so this has another name called lipid water partition coefficient. So what is lipid water partition coefficient? Simply, if the lipid solubility of the drug is divided by the water solubility of the drug, it is the ratio will be the lipid water partition coefficient. If the lipid solubility will be more, the lipid water partition coefficient will be more, and the drug will be more soluble, or the drug will easily cross the biological membrane. If the lipid water partition coefficient will be less, then the drug is more water soluble and it can't easily cross the biological membrane. Okay, then there's another thing in the solubility, or in the in permeation. I have to talk about this is molecular weight. Okay, so most of the drugs are 100 to 1000 Dalton. Okay, less than 100 Dalton drugs, it easily cross the biological membrane. And if the drugs are more than 1000 Dalton, okay, then they can't easily cross the biological membrane. Like we have the drug called insulin. Okay, so the insulin has a molecular weight of 5808 Dalton. Okay, so that we can't give insulin orally because it can't cross the epithelium and enter into the blood vessels. Okay, so it can grow, it can absorb orally. So we have to give insulin intravenously. There is another reason why we can't give insulin orally, because the insulin is a protein drug. Okay, so there are proteolytic enzymes in our gastrointestinal tract. If we give insulin orally, these proteolytic enzymes will degrade the insulin, and that's why we give insulin intravenously. Then the thing is concentration gradient. Most of the drugs are cross the biological membrane through simple diffusion process. Yeah, drugs can cross the biological membrane through active transport. They can cross through filtration, but they mainly cross the biological membrane through simple diffusion process. And the simple diffusion process depends on concentration gradient. Okay, let's assume that you have taken a drug orally. Okay, so in the beginning, there is the high concentration of the drug in your alimentary tract, and there is low concentration of the drug in your plasma. So from the high concentration, the drug will go into the low concentration area because there is a high concentration gradient. So because of high concentration gradient, the drug can easily diffuse into the plasma. But as the drug is rapidly going from the alimentary tract into the plasma, the concentration of the drug in the plasma will increase, so that after some time, when the concentration in the alimentary tract and the concentration in the plasma will be equal, the drugs cannot diffuse into the plasma. Okay, the remaining drugs will be excreted. There is another thing that affects this permeation is vascularity. Now, let's assume that you have taken a drug intramuscularly. Okay, there is intramuscular injection, and you have your drug into this muscle, and there is your blood vessel. Okay, and the drugs are diffusing into the plasma. Okay, if there is good blood flow, the drugs will be removed from this, or taken away by the blood from this area to the remote area. Okay, to the remote area, and there will be again decrease in the concentration of the drug in this particular area of the plasma, and there will be more absorption of the drug. But if there is less vascularity, okay, maybe because of some pathology there is decrease in vascularity in this particular muscle, then these drugs will be accumulated into this area, and there will be more and more concentration. Okay, there will be increased concentration, but there will be decrease in concentration gradient. Okay, so due to the decrease in concentration gradient, the drugs cannot be absorbed into the plasma. So there is a major role of vascularity in absorption and also in permeation, like in absorption, in excretion, and distribution of the drug. There is another thing called surface area. Surface area is also very much important. mainly in case of absorption, because if you think about oral absorption, there is the stomach and there is small intestine. Okay, so in the stomach we have small surface area, but in the small intestine or in the intestine or in small intestine we have large surface area. So where the drugs will be absorbed more? Obviously in this large bowel or large sorry, not in the large bowel, where there is the large surface area or in the small intestine. Okay, so there will be increase in uh, increase in absorption in the small intestine, not in the stomach. Okay, the most important thing I'm going to talk about in this video is ionization of the drug. Most of the drugs we have are weak acids or weak bases. Okay. Like you can say that there is a weak acid called aspirin, then loop diuretics, then there can be thiazide diuretics. Okay, they're weak acid drugs. Weak bases, like we have morphine, we have local anesthetics, we have amphetamine. So these are some examples of weak acid drugs and weak bases. Okay, and we have to remember in this case, this ionized drugs are more water soluble drugs, and non-ionized drugs are more lipid soluble. So non-ionized drugs can easily cross the biological membrane, but ionized drugs can easily cross the biological membrane. Okay, let's say that if a drug is weak acid, then we can express this drug as HA. For our benefit, we express this drug as HA. And when this drug is, so what is acid mainly? That gives hydrogen. Okay, so we will write this like that if this drug gives hydrogen, it will be ionized into A minus and there will be H plus. Okay, and this is a form of non-ionized drug. Weak base, if B, the drug is weak base, bases more likely they take H plus. Okay, so by taking H plus, it will convert into BH plus. Okay, so if you write this reaction like this BH plus is divided into B plus H plus, then you can see that BH plus is the ionized form and B is the non-ionized form. Now, let's assume that you have taken a weak acid drug or HA orally. Then, when you have taken this as orally, this is your alimentary tract, this is your stomach, and this is your small intestine. In the stomach, you have acidic environment. Okay, then here is your HA drug. Okay, in the acidic environment, there will be a lot of H pluses. Okay, there will be a lot of H plus. So if the HA drug is converted into the A minus plus H plus, this A minus will take these H pluses and convert again into the HA, so that this HA form is non-ionized form. And this non-ionized form is more lipid soluble, so that it can easily cross the biological membrane and easily absorb into the circulation. But if you see, in the small intestine, you have a basic environment. Okay. So if this HA drug comes into the small intestine, it will divide HA, it will divide into A minus and H plus. Okay. Then there will be more and more A minus form of the drug. And this is the ionized form of the drug. The ionized form of the drug is more water soluble, so it can't easily cross the biological membrane, and there will be less absorption of the drug in the small intestine. Okay. Now let's talk about the pKa, or ionization constant. What is pK? It is a pH where the drug is 50% ionized and 50% non-ionized. Okay. So if this is the HA drug, H plus plus A minus. So if in an environment 50% drug is HA form or non-ionized form, and the 50% drug is A minus form, okay, then the pH will be called the pK of the drug, or the ionization constant of the drug. So what is the importance of knowing the pK of the drug? Okay. So it is the stomach and that is the small intestine. Okay. Let's assume that you have taken a drug called HA. It is a weak acid. Okay. The pK of the drug is 3.5 and the pH of the stomach is 2. Then we can say that the pH of the environment is relatively acidic to the drug, because the pH of the environment is less than the pK of the drug. So that we can say that this pH of the environment is relatively acidic to the drug. And that's why if the drug is a weak acid, in the acidic environment, in the relatively acidic environment, the weak acid drug will be more in non-ionized form, and it will increase, it will readily cross the biological membrane, and there will be increase in absorption. Okay. In the small intestine, the pH is 7. Let's assume that the pH of the small intestine is 7 and the pK of the drug is 3.5. In this case, the pH is relatively basic to the drug, because the pH is more than the pK. And in this environment, if the drug is weak acid, because the pH is more, the weak acid will give its H plus and it will turn into ionized form. And in this ionized form, it can't cross the biological membrane. Okay. Similar to the weak base, in case of weak base, you can see that in the stomach, there is pH like 2, and there is this base drug, okay, and basic drug, and the pK, let's assume that pK of the drug is 7, okay. So the pH of the environment is relatively acidic because the pH is less than pK, and in this environment there will be more and more H plus to take by this basic drug, okay. So this will turn into the pH plus form, or it will be more ionized form, okay. And if it is more ionized, then it can't cross the biological membrane easily. In the small intestine, let's assume the pH is 7, or it can be 8, and the pK of the drug was 7, okay. Then the environment is relatively basic to the drug. So in the basic environment, basic drug will be more non-ionized form, and it can easily cross the biological membrane and gets absorbed into the circulation, okay. So from this we have come to a conclusion that acidic drug in acidic environment is more in non-ionized form. You have to remember, or you have to remember that this acidic environment is really relatively acidic to this acidic drug, okay. And basic drug in relatively basic environment is more in non-ionized form, and if it is more in non-ionized form, it can easily cross the biological membrane. If you come to the renal system, you have seen that glomerulus, we can a nephron, if we just okay, if it is a nephron, just assume that it's a nephron. Well, I haven't drawn the real nephron, but let's assume that it's a nephron, okay. If you make the urine acidic, how can you make this urine acidic? Okay, acidic urine, okay. If you make the urine acidic, you can make the urine acidic by taking ammonium chloride, taking vitamin C, or cranberry juice, okay. These things will make your urine acidic. If the urine is acidic and you give the person an acidic drug, then in this urine the acidic drug will be more non-ionized form, and it can be easily reabsorbed into the circulation, okay. But if you give the person a basic drug, in the acidic urine, the basic drug will be more in non-ionized form, and it can't reabsorb into the circulation, and it will be readily excreted, okay. So if we make the urine acidic, the excretion of the basic drug will increase, okay. So in case of poisoning of basic drug, we can make the urine acidic. We can also make the urine alkaline, okay. To alkalinize the urine, how to alkalinize the urine. To alkalinize the urine, you can use sodium hydrogen carbonate, acetazolamide. So, if a person came with morphine poisoning, okay, or you can say amphetamine poisoning, sorry, if a person came with aspirin poisoning, okay, aspirin poisoning, okay, so in case of aspirin poisoning, you can make the drug, make the urine more alkaline, so that this aspirin, which is a weak acid, can easily excrete through the urine. To increase the excretion of the acidic drug, you can alkalinize the urine. There are some bacteria also that can affect the or make the urine acidic, like Proteus or urea plasma. Okay, so that's all for this video. Thank you very much.